50 states. Tonight, coronavirus deaths now in all 50 states. The toll more than 23,000 in America. Over 10,000 dead in New York alone, but the governor's saying, quote, the worst is over if people stick to self-distancing. And now the battle over how and when to reopen the country. President Trump targeting May 1st, but feuding with governors. He says the decision is his, not theirs. Plus those three keys to getting America back to work: rapid testing, antibody testing, and contact tracing. Where do those efforts stand tonight? Also, the tornado disaster in the middle of the pandemic. Dozens killed, and tonight 130 million at risk from Florida to Maine. A sea of cars lined up at food banks, Americans waiting overnight to feed their families.
We have to do this to survive.
Despite huge demand, why so many farmers are being forced to destroy fresh food. And the first wave of relief checks rolling out, the new way to get your money faster. And our exclusive look inside the ICU, conducting trials on a potential coronavirus treatment with surprising results. Are they close to a breakthrough?
This is NBC Nightly News with Lester Holt.
Good evening. Some encouraging patterns in COVID-19 cases, along with a restless craving for normalcy, are fueling discussions on how and when to restart parts of the American economy. Governors in 7 eastern states and 3 western states tonight working together to map out a cautious way forward as President Trump asserts it's his call to make. That debate underway as the death toll from the virus in the U.S. tops 23,000. Now in the middle of it all, tragedy doubling down on parts of the South in the form of deadly tornadoes. Our team has it all covered. We begin with Gabe Gutierrez.
Tonight, as powerful winds and heavy rain pound the nation's epicenter of the pandemic, a break in the ongoing storm. While the death toll has topped 10,000 in New York State, ICU admissions and intubations are dropping. The number of newly hospitalized patients is the lowest it's been in 2 weeks.
The worst can be over, and it is over, unless we do something reckless.
Governor Andrew Cuomo is clashing publicly with Bill de Blasio over whether the New York City mayor has the authority to close schools through the remainder of the academic year.
It is not shocking that sometimes there's just differences of perspective.
Today, strong winds threatened this field hospital in Central Park and forced the closure of several testing facilities across the region. Ariana Dumas is an ICU nurse at North Shore University Hospital who brings iPads to her sickest patients to help them connect with their loved ones.
I was holding the iPad and I was holding her hand and I'm hysterical crying and I'm in all my gear. So like my glasses are all foggy and I was just like, oh my gosh, like how am I gonna handle doing this for multiple people?
One of her patients died on Sunday.
Just holding his hand, playing the video, and crying. That's like kind of the perfect scene of what it looks like when we're in there.
Among the lives lost, William Sullivan, a beloved police detective in Yonkers. Anthony Causi was known as one of the best sports photographers in New York City. For decades, Rakon Kim had been a mailman in the Bronx.
We were just hoping for the best, but in the end, they said that he isn't going to make it past today.
At this rate, COVID-19 is killing as many New Yorkers in 3 days as the seasonal flu typically does in an entire year. Gabe Gutierrez, NBC News, New York.
I'm Miguel Almaguer. Tonight, the director for the CDC says the coronavirus epidemic in our nation could peak in days. Top doctors believe the deadly outbreak has stabilized, but warn of new hotspots and dangerous clusters. In South Dakota, at Smithfield Foods, one of the largest pork plants in the U.S., hundreds of employees have the virus.
We're testing people there more at a higher rate.
After the deaths of dozens of grocery store workers who caught the virus, doctors maintain social distancing is saving lives.
To keep a safe distance of 6 feet.
In Georgia, drones are reminding residents to keep their distance. While in Philadelphia, a man was removed from a bus after arguing with the driver when he refused to wear a face covering. In Detroit, at Henry Ford Health System, roughly 1,000 employees have the virus. Near Los Angeles, the family of 20-year-old Valeria Viveros, who worked at a nursing home, says she lost her life a week after getting sick.
What can I say? It's shocking, you know? It's shocking.
With a sailor who served aboard the USS Theodore Roosevelt among those who have also now died after contracting the virus, 9 states have more than 20,000 confirmed cases. But in hard-hit Illinois, positive signs of a slowing spread. Across the border in Missouri, this St. Louis family of 5 welcomed home after they were all infected.
Thank you, thank you, thank you!
Jane Winehouse and her husband Michael are now out of the ICU.
It was extremely scary, especially for Jane on a ventilator because I wasn't. So it was extremely scary.
With our nation still in crisis, there are promising signs of better days ahead. This 93-year-old grandmother in Pittsburgh going viral with her playful request for beer. In Long Island, when Korean War veteran Herb Berger couldn't join family and friends to celebrate his 90th birthday, local police brought a parade to his front door.
I'll shake your hands. I'll salute you, though.
And there's more positive news here in L.A. County, where the number of new cases is the lowest it's been in a month. But that stay-at-home order has been extended in this area through May 15th. Lester?
Yeah, this isn't close to being over. Miguel, thanks very much. As discussions intensify over how to ramp up the economy, many governors and the president's own health experts warn it can't happen all at once. Peter Alexander is at the White House.
President Trump tonight eagerly eyeing what he's called a big bang to restart the economy as early as May 1st, expressing optimism.
We're getting rid of the plague. It's a plague on our country like nobody's ever seen.
Dr. Anthony Fauci envisioning, in his words, a rolling re-entry, possibly next month.
It is not going to be a light switch that we say, okay, it is now June, July, or whatever, click, the light switch goes back on.
The CDC director cautions against moving too quickly.
It's going to be a step-by-step, gradual process. It's got to be data-driven.
Among the keys to safely getting back to business, according to public health experts, a major increase in tests to see who has the virus, wide use of an antibody test to determine who's already had it and may now have immunity, and contact tracing to isolate people who've interacted with someone who's infected. Vice President Mike Pence today asking governors for help ramping up testing, with concerns testing machines still are not running anywhere near full capacity.
Increasing in testing is continuing on a daily basis, and it is going to need to be in place in order for us to effectively reopen.
And after weeks saying it was up to governors to impose stay-at-home orders, President Trump is now insisting he has the sole power to decide how and when states reopen.
When somebody's the president of the United States, the authority is total. And that's the way it's got to be.
In fact, most legal experts say the president does not have the authority to direct states to lift their emergency orders. Tonight, the governors of 7 northeastern states that represent more than half the nation's coronavirus cases are banding together to outline the steps they will take to ease restrictions. 3 western states doing the same.
This has to be informed by experts and by data. You take one step forward, you see how it works, and then you measure the next step.
Also making headlines tonight, President Trump's retweet of a post with the hashtag #FireFauci, after Dr. Fauci acknowledged more lives could have been saved if the country had been shut down earlier.
But there was a lot of pushback about shutting things down back then.
And late tonight, when the president called Dr. Fauci to the podium, Fauci said that was the wrong choice of words and said the president has taken his advice. President Trump later said he is not firing Dr. Fauci. Lester?
All right, Peter, thank you. We'll have much more ahead on those 3 keys to unlocking the country, including the way Apple and Google are teaming up tonight to track the virus. But right now, we want to tell you some other major headlines. 5 days after he ended his presidential campaign, Senator Bernie Sanders today endorsed former Vice President Joe Biden. As the two appeared in a video, Sanders told Biden, "We need you in the White House," and said he'll do all he can to make that happen. Also tonight, the tornado disaster in the middle of this pandemic. 130 million people are under wind alerts from Florida to Maine after dozens of twisters killed at least 33 people in the South. Our Morgan Chesky in the storm zone tonight.
Tonight, the South facing a disaster nightmare.
Watch it coming! Yep, I see it.
More than 50 reported tornadoes since Sunday.
All I heard was like a loud roaring sound and a lot of cracking sound.
In Louisiana, Willie Grayson's family was watching an Easter service on TV.
Dinner table was here
when the tornado struck.
I'm getting the kids, telling them to get under the bed. I'm yelling for my wife. She's screaming, the roof coming off. She runs, trying to run to me, and then the hall roof flew up.
This home ripped right off its own foundation, stopping drivers in their tracks after being tossed into the road. NBC's Blaine Alexander is in Georgia.
And all of a sudden I heard that train noise. I was getting in the closet. Front end of the trailer was coming up.
With you inside?
With us both inside.
Got a funnel cloud right here in front of me. In Mississippi, a tornado so powerful, radar captured debris thrown up to 60 miles away.
The damage these storms leave behind forces an incredibly tough call. How to enforce stay-at-home orders for a virus when hundreds have no house to go home to.
We would typically go to a school gymnasium or something like that we'd set up a shelter. So we're trying to get people into hotel rooms.
In Alabama, those stay-at-home orders suspended. Images inside storm shelters capturing people doing whatever they can to social distance.
And tonight, this storm system that caused so much damage here has now taken a turn and is heading north up the eastern seaboard, where it could cause even more problems. Lester?
All right, Morgan, thank you. We'll be back in 60 seconds with those desperately needed relief checks finally going out. And if you haven't gotten yours yet, how you can get it faster. The first wave of those much-anticipated relief checks for many Americans has finally started to roll out. But if you're one of the millions still waiting, our Stephanie Ruhle explains how to get your money faster as so many families struggle.
Bumper-to-bumper traffic for miles waiting to get into food banks.
Keep it going.
As millions of suddenly unemployed Americans now struggle to get food on the table.
We have to do this to survive. I'm just a single parent. There's nobody but me.
Thousands of relief centers from Pittsburgh to St. Louis and Honolulu. Staffed by volunteers, traffic cops, even the National Guard.
I had a lady here yesterday with 4 little kids in the car, and she says, I'm a waitress and I don't have any food.
But people aren't just there for food.
Almost every parent, right, who has to come and ask for diapers, you can feel this and see this just like visceral fear and worry.
In Texas, 6,000 cars waited to get into this San Antonio center, many camping out overnight.
When they see that box of food coming into the car, some of them smile and some of them cry.
We're seeing them from all income levels because when somebody gets laid off and the income stops coming in, even if they may have a fancy car or fancy house, they're going to be hungry.
Though demand is up, inventories have plummeted.
It's devastating. It's something that none of us could have ever predicted.
Farmers across America have no way to ship their food to the places that need it most. Carrie Sanders is in Florida.
Food banks report they're overwhelmed with demand, while farmers in Florida in the middle of their harvest say they are heartbroken because the logistics just don't exist to get the fresh corn, green beans, and other vegetables to those who need it. Instead, it's all being plowed under.
But for many families in need, help is on the way. Stimulus checks are now being distributed for anyone making less than $99,000 a year. You get the full $1,200 if your salary is under $75,000, and an additional $500 for every child. For those who file taxes using direct deposit, the money should hit your account soon. For 80 million Americans, it'll be this week. Paper checks are expected to start getting mailed in May. If you didn't have to file taxes, you can enter your bank information at irs.gov. The government also plans to launch a new online tool allowing you to track your payment status. While the government is rushing to get these payments out and even discussing another possible stimulus package, there are many Americans worried about mounting bills. So for the time being, take advantage of relief programs out there and call your lenders to find out more. Lester?
All right, Stephanie, thanks very much. Good advice. Most health experts agree the key to reopening the country while also stopping the spread of coronavirus is testing. And there are developments tonight on a test that can tell if you've had the virus and may now be immune. Here's Gadi Schwartz with that.
With much of America shut down, tonight the promise of progress. New COVID-19 blood test called antibody tests could help get some Americans back to work. Dr. Margaret Zhang just took one in New York.
Having antibodies and knowing that I'm as immune as one could be to COVID right now makes me feel even more kind of inclined to serve.
UCLA began using its own version of antibody testing, focusing on thousands of medical workers.
How can we expect our health workforce to be protecting us if we're not doing everything that we can to protect them?
The concept is simple. If you've had COVID-19 and recovered, it's because of special antibodies in your immune system that have developed to fight it off, and those will likely protect you from future infection. In the case of medical workers, those with antibodies could become super soldiers in the fight against COVID-19.
I think that healthcare workers who know that they have antibodies will be able to go into to their work more confident that they're not going to be getting themselves sick or then passing this virus on to others around them.
Other tests are being given to the general public in Los Angeles as well. 64-year-old Deborah Presley had her finger pricked and blood drawn as part of a USC study. Within minutes, she learned she had antibodies to fight off coronavirus.
When you found out that you had the antibodies, what went through your mind?
I'm a caregiver, and I go to different people's homes, and it's just such a relief because now that I can help other people.
Now dozens of labs all across the country are working on their own antibody tests. Last week, the Trump administration said they are working to make antibody testing free and widely available.
Starting with the next week or so, we'll be able to scale up the kind of antibody testing to give you a good feel for what the penetrance of the infection is. But you can start think about some aspect of getting back to normal without having tested everybody in the country, that's for sure.
But the FDA commissioner also warning not every antibody test is accurate.
No test is 100% perfect, but what we don't want are wildly inaccurate tests.
Then there are the diagnostic coronavirus tests, but all told, still less than 1% of the U.S. population has been tested. Just a fraction of what experts say is needed to get a clear sense of how many people may be infected. For now, making complete contact tracing still out of reach. Something authorities say is vital for stopping the virus's spread.
And Lester, tonight, even Apple and Google unveiling new plans for a voluntary app that would basically alert you if you've come into contact with a known carrier. Both companies stressing tonight that privacy is their top concern. Lester?
All right. Gadi Schwartz tonight. Thank you. Up next, our exclusive look at a potentially life-saving treatment. Tonight, the surprising results. While researchers around the world focus on finding a vaccine, there's also an urgent effort to develop more immediate treatments. Tonight, we have an exclusive look at a drug trial with some early but encouraging news. Here's Tom Costello.
On the ICU floor at Emory University Hospital in Atlanta, a drug trial for a potential lifesaver.
This is remdesivir versus placebo for one of our patients.
Doctors prescribing remdesivir delivered in IV form to patients sick with COVID-19. The Emory trial is one of the largest in the world. Infectious disease expert Dr. Anish Mehta is the chief investigator.
What we're searching for are medications that will help people get over the infection more rapidly and allow their immune systems to really kick in and knock the virus out of their body.
Remdesivir was originally tested to treat Ebola patients, but early results suggest it could be far more effective in treating COVID-19. It's a double-blind NIH study, meaning patients and doctors don't know who gets a placebo.
What we have seen is lots of patients recovering. Whether that's because they're getting a study drug or a placebo, we don't know.
In Washington state, ICU doctors did give remdesivir to Chris Kane as he struggled to breathe.
I mean, within 48 hours, I was feeling a lot better.
We're just so thankful. And then to get him on this drug so quickly was just an absolute godsend.
Now, researchers could be just 2 to 3 weeks away from a major breakthrough, determining whether remdesivir should be the go-to treatment in hospitals. Meanwhile, doctors are increasingly cautious about an unproven treatment touted by President Trump, hydroxychloroquine combined with an antibiotic. Researchers in Brazil canceled a small chloroquine study after some patients developed cardiac arrhythmias and even died. But back at Emory, some COVID patients are insisting on getting what they heard President Trump talk up.
And they say, I don't want an experimental drug. I want the drug on the news.
If approved, drug maker Gilead says it could have enough remdesivir to treat 140,000 people immediately and 500,000 by October. Lester?
All right. Tom Costello tonight. Thank you. Up next, Beating the Odds, inspiring so many others. Finally, he survived his harrowing battle with coronavirus. Now a heartwarming celebration. Here's Steve Patterson.
This Easter Sunday, a California hospital resonating with waves of applause for 50-year-old Ramon Zuniga, who fought the coronavirus and won after spending 19 days on a ventilator.
I seemed to exist, but I really wasn't sure if I existed. I didn't know if I had passed on or not.
For over a month, ICU Dr. Alex Hakim documented Ramon's journey and, in a way, his own.
I don't know if I have the right words right now to express just how I feel. I'll remember it for the rest of my life.
And as for Ramon, he's grateful for the gift of life.
I've managed to beat this, but all the credit goes to them, all the nurses, all the doctors.
But you gave them hope.
Hope. That's what doctors and nurses who saved Ramon will carry with them as they head back to the front lines. Steve Patterson, NBC News, Los Angeles.
That's the kind of beautiful moments we want to see more of. That is Nightly News for this Monday. I'm Lester Holt. Please take care of yourself and each other. Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.